A method for describing disease. As a farrier, you're going to come across diseases of the horse's leg and foot from time to time, where you will be the first person to have noticed them, and this will be because you are the one that is going to most often run your hand down the horse's leg and have a close look at the horse's foot in particular. So before we go any further, let's have a look at the word disease. What exactly do we mean when we say the horse has a disease? Webster's Medical Dictionary describes disease as an interruption, cessation, or disorder of body function, system, or organ. So that's a pretty broad definition of the word. So it covers pretty much any change of a function of the body, of a system of the body, or of specific tissue or organ of the body. Another way to look at it is to take the word and deconstruct it. So take it apart, and it's actually two words, dis-ease, which is the opposite of ease. So when something is wrong with the body, or function or tissue of the body, we say it's in a state of dis-ease. So the system that we're going to use was developed in Britain, and it's called the DACT system, D-A-C-C-T, and it's an acronym for D stands for description of the condition. So it's just a description in layman's terms, given the location and what it is that you observe. A is for anatomy of the structures involved. C is for clinical signs of the condition, so just a more detailed, in-depth description of what's involved. C is for cause of the condition, so just try and figure out what it is that is causing the problem. And then T is treatment of the condition, including prognosis. And of course the treatment from a farrier's perspective is going to mean you're looking at it from the point of view of trimming or shoeing or maintenance of the hoof in a different manner than usual. But of course a lot of these conditions are going to involve much more than just a farrier. You're going to have veterinary intervention with a lot of them. So again, the acronym is DACT, D-A-C-C-T, description, anatomy, clinical signs, cause, and treatment. So one example that I've taken here, we've got a slide of a horse with side bone. The near forehoof on the lateral side, just above the hairline, has a pronounced bump on it compared to the medial side of the hoof. It looks as though the hoof is not set on the leg correctly, but in actual fact there's an extra bony growth just under the skin above the hairline. The circle shows the area where the side bone is located. So a description would be that there's a hard swelling on the lateral aspect of the near fore, just above the hairline. How would you check this to see if it might be side bone? You'd pick the hoof up so it's unloaded and then palpate the collateral cartilage to see if it moved the way a healthy collateral cartilage should. If it doesn't, then you'd suspect that there's something wrong. To palpate it with your thumb, you can either just push on it with your thumb, or as in this slide, grab it from behind with your thumb and finger and move it in and out. Healthy collateral cartilage should move with some resistance but rebound to its original position. If it's hard, and then you can suspect that there is some change going on in that area. This slide shows quite well the extent of the collateral cartilage. You can see that it's quite prominent above the hairline. The hairline would extend around the leading edge, the top edge of the coronary cushion, and that whitish material directly above it is the collateral cartilage. This is quite a large collateral cartilage in this specimen. Here we have a slide of third phalanx, or P3. This is a healthy bone with no extra ossification on the wing. The back part, the right hand side of the bone, is the wing of the bone. PPDP, that area is the wing of the bone. PG is the palmar groove, and sometimes that groove will actually divide the wing in two, so you have an upper and a lower part to it. This bone, it's not divided so, but you can see that there is a hole, or a foramen, that a large blood vessel passes through and lies along that palmar groove or plantar groove. This individual has a nice healthy bone. Notice how much lower the top edge of the wing of the coffin bone is compared to the top edge of the extensor process EP. So the area inside the red circle shows you the area that we should be focusing on, and how that wing is not anywhere near the same height as the extensor process. So on this slide, even though it's taken from a different view, it's quite obvious that the collateral cartilage on the medial and lateral aspect have both been ossified. They've been turned to bone from cartilage. Essentially, they have completely changed the constituency, or consistency. They are hard and unyielding, and they're just as much bone as the rest of the coffin bone is. So the top edge of what used to be the collateral cartilage is now at least the same height as the extensor process. So this is quite a large side bone on this individual. And if you were to try and push on these, it's quite obvious that they're not going to move. This is a radiograph showing two horns that you can see inside the red circles, and that's what side bone would look like in a living horse that had a radiograph taken. These side bones again would be fairly large and should be obvious to thumb pressure. So side bone, how would we use the DAX system to describe this condition after looking at all those photographs? Well, to start with, the description would be a swelling and hardness or hardness on the medial or lateral coronary band area at the quarters. The anatomy that's involved: the collateral cartilage of P3, the wings of P3, the ligaments of the collateral cartilage of P3, the hoof, and the corium. Clinical signs would be that the cartilage are hard when palpated, radiographs reveals ossification, and there may be shape of hoof may be altered, or change of shape of the hoof, and you may have a change in the wear pattern on the shoe from what would have previously been the norm. So causes could be trauma, and trauma you could divide into either a single event trauma or an insidious or long-term trauma that has caused a slow but gradual change from cartilage to bone. Single event trauma would be something like another horse tramping on that part of the horse's leg, or horse cutting that part of the leg on something sharp, or banging it against something hard enough to damage that part. It is also quite often attributed to conformation. If the horse has very little in the way of shock absorbers in its leg, that is, it's very straight-legged, a vertical hoof wall, such as a severe clubfoot with a very straight front leg, then it's quite possible that if the horse was asked to do work on a hard surface, that side bone would be a result. Butler maintains that it's a natural process in older horses. That's debatable. It is not really that common a condition, and yet there are lots of older horses around. Now that doesn't mean that there may not be some ossification of the collateral cartilage, but whether it's full-blown side bone or not is debatable. It certainly does appear to have a hereditary predisposition, and that would lead back to the conformation. If the mare or stallion has poor conformation, then conformation combined with inappropriate work will predispose a horse to this. So on to the treatment. The treatment would usually involve trimming to minimize stress, so make the horse as comfortable as possible if it is lame at the time. If it's not lame, then don't make any large changes, just keep the feet as short as possible and make a shoe to resemble the worn shoe. Sometimes pads will be useful. But the point of all of this is to show how, using the DAX system, you can run through the disease from beginning to end, in that you start out with a general description, which would be what you would give to the owner. Then you need to be able to figure out what the anatomy is that's involved. You need to take a good look at the clinical signs so that you and the vet may have a more in-depth discussion about it, or you, the vet, and the owner have a more in-depth discussion about it. Someone needs to figure out the causes, and the farrier should be part of that conversation. And then certainly in this condition, the farrier would have to be part of the treatment. So another example, we'll quickly run through this, would be thrush. The description: a common bacterial infection of the frog sulci, or the central cleft of the frog. The anatomy. The anatomy that will be involved would be the frog and possibly the frog corium. The frog stay, that keel that sticks up into the digital cushion, will be involved in a deep-seated thrush. Clinical signs. Horses are rarely lame from thrush, but they can be. There will be a foul-smelling black necrotic exudate that will drain from the frog sulci or cleft, and there will be a black crumbly material that you will find around the top edge of the cleft of the frog, and the cleft will have progressed all the way into the bulbs of the heels and quite high up into the bulbs of the heels. So causes. Generally, the classic cause has always been filthy stabling conditions. This isn't quite as common anymore, but you still see quite a bit of thrush. Usually it's from trapped anaerobic bacteria, so it can be from the horse being confined too much, or it can be from poor hoof conformation, or it could be from incorrect trimming or not enough trimming, in that the horse is not having his feet trimmed often enough, or poor shoeing. So incorrect trimming would be either the frog is being over trimmed, or else it's being under trimmed, or the heels of the hoof could be over trimmed or under trimmed, or the toe of the hoof under or over trimmed. So as you can see, it pretty much covers just extremes in either direction, and it may take a little investigating to figure out exactly what the causes are, but usually the first step is to open up the cleft of the frog and let some fresh air in there and get the dirt out as quickly as possible. Treatment would be removal of the diseased tissue, so all the rotten frog should be taken off. The area does need to be scrubbed. It will be probably trimmed down to corium, and in some cases it may be that the corium is damaged. The horse may need to have the sensitive tissue covered with a pad, so you may have a hospital plate on the horse. In severe cases, I have read of a treatment where the frog is surgically removed, and then a new frog will regenerate, but that will take weeks or months. The horse may need a topical medication, may need antibiotics. So it's going to take the combined efforts of the owner, the vet, and the farrier to relieve the horse of this condition. But again, the point here is to show how we can quickly use the DAC system to cover all the points that are needed to be covered, to make sure that everything has been examined and nothing's been missed. So again, DACCT: description, anatomy, clinical signs, causes, and treatment. So now we're on to the self-test part. So why is a method necessary to describe disease? What is the definition of the word disease? What does DACT, D-A-C-C-T, stand for? Give one example of a bone disease, hoof disease, and a tendon disease. Use the DACT, D-A-C-C-T system to explain a disease.